Let me talk about something many women struggle with quietly, which is recurrent vaginal infection. You treat it, it will clear. Then weeks later, it will come back again. If this sounds familiar, then this video is for you. Because in the next few seconds, I'll be explaining why vaginal infection keeps reoccurring and the lab test that helps us find the real cause. And guess what? If you stay till the end, you will get to decide how to get information on prevention, so that we'll not just be talking about what causes it and the lab test to diagnose it, but you will know what to do to prevent it from reoccurring again. But for those watching me for the first time, hi, I'm Amy Thompson, a medical laboratory scientist. I simplify health and lab tests so that we can make better informed decisions about our health. Let me start from the symptoms women commonly face when it comes to vaginal infection. We usually experience recurrent itching or burning sensation in our mucous area. Sometimes you will experience abnormal discharge, which can be thick, watery, yellow, greenish in color. In some cases, it is even cloudy, looking like cheese. Some persons experience unpleasant vaginal odor, while other ladies may even experience pain during urination or intercourse. And what makes it recurrent is that when you treat it, it will go, and before you know it, the above symptoms will return again. But listen very carefully. There is a truth many women don't know, that not all vaginal infections are the same. So treating it blindly is why it keeps coming back every time. So in order to not treat it blindly, we need laboratory tests that will help us diagnose what is the cause of this recurrent vaginal infection. And these tests include 1. High vaginal swab microscopy, because this will help you identify whether it's a yeast infection, bacterial infection, parasitic infection, or an inflammation. Then the next one, you go a step further in doing vaginal culture and sensitivity. This is very important too, because in recurrent cases, we need to know the exact organism and what treatment actually works. And sometimes your doctor will not just stop here. Your doctor may still ask for an STI screening, because some of the recurrent vaginal symptoms you may be having may be as a result of other infections that mimic common vaginal infection symptoms. So this is why proper diagnosis matters a lot. You can't prevent recurrence if you don't know the cause. So you need your lab test to help guide your doctor to ensure proper treatment is done. Please avoid repeated self-medication, because sometimes all this taking over-the-counter medication does your treatment plan. But you know what? Before I end today, those that have been following me know that every Saturday I go on a live session by 7:30 West African time. So tomorrow I'm planning another live session, and this time I want it to be on how to prevent vaginal infection from reoccurring. Because we should not just end by knowing what causes it. We need to learn how to prevent it. But since I'm not a medical doctor, I don't want to offer treatment. I just do preventive measures on this page. Tomorrow, if you want me to invite a doctor colleague of mine to join me on my live session and teach this properly, then comment women's health. If I get sufficient women's health in the comment section, it will be our entire topic. See you next time. Bye.